About today's health headlines here. June is Myasthenia Gravis Awareness Month.
So what is myasthenia gravis? How is it diagnosed and what treatments are available? Joining us this morning, Dr. Kunal Desai, neuromuscular medicine specialist at Yale Medicine and assistant professor at the Yale School of Medicine. Doctor, great to have you with us this morning. And I have to start out with the obvious question I'm sure a lot of our viewers are asking. What is myasthenia gravis?
Thank you so much for having me on. So myasthenia gravis, in a nutshell, is a autoimmune disease where the immune system starts affecting and attacking the junction between the nerves and the muscles, or the neuromuscular junction. And it causes fatigable weakness in that people feel as that they do more or exercise or go through their day, they start to feel weaker and weaker. It can cause things like double vision, droopy eyelids, difficulty swallowing, speech problems, as well as weakness in the limbs and shortness of breath.
Now, some of those symptoms that you just listed, I feel like a lot of us could say we experience those regularly if maybe we worked out too hard or maybe we're just overly exhausted. So I guess since some of these symptoms are easily dismissed, how is this typically diagnosed?
Right, so it can sometimes be challenging to diagnose, and that's why some of the hallmarks that we look for are things like droopy eyelids or double vision, which are somewhat unusual symptoms. Because you're right, we all feel fatigued after a long day, and that doesn't mean we have myasthenia. It's a relatively rare disease. So it can be somewhat challenging. This is where attention to some of those symptoms, especially dramatic fluctuations in the symptoms, can be a sign of this disease. And that's why seeing a neurologist, neuromuscular specialist, where we can do additional tests to try and figure out whether somebody has myasthenia gravis.
Yeah. Doctor, let's talk treatment now. What kind of treatments are out there available if somebody begins to experience some of these symptoms?
So the world of myasthenia gravis is changing rapidly. There's many available treatments now. The sort of classic treatment for this is to suppress the immune system with something like a steroid like prednisone. And then there are various other oral alternatives for treatment. And now there are newer biologic agents, immunotherapies, that are even more effective in some cases and are available for treatment. So there are a slew of options for treatment, which is making it much easier for some of our patients these days.
And doctor, before we let you go here, I'm curious to know, is myasthenia something that you see more with adults than younger people, or it really impacts anyone of any age?
In theory, it can impact anyone of any age, but we typically see it in our younger middle-aged adults, although we have patients at both ends of the spectrum.
Okay.
All right, Dr. Desai, thank you for being with us this morning.